Good afternoon to all of those that have joined. There are about 20 of us on right now. We'll take a few minutes to wait for others to arrive. Thank you for joining. Thank you again for joining us on this webinar. We will take a few more minutes to wait for others to arrive. Please familiarize yourself with the chat function. We look forward to receiving questions throughout the presentation that come top of mind. Please ask those in the chat function, and we will address those and share those with the presenters. If you have a specific question for a specific presenter, please mention that you would like either Sarah, Aisha, or Catherine to address that question. So as your moderator representing the Health Equity Initiative, I'll introduce the webinar series and our speakers after sharing a brief introduction to Health Equity Initiative, as well as a definition for health equity and the webinar format. So thank you again for joining us in the Health Equity Initiative's second webinar in a three-part series supported by the Robert Wood Johnson Foundation and in partnership with the Gehl Institute. Today's webinar builds on our first webinar about urban planning for non-urban designers. This webinar will employ 3 case studies to demonstrate community engagement strategies in successful and innovative urban design projects. So speakers from Kaboom, Archive Global, and Friends of Bushwick Inlet Park will share their experiences advocating at the community level and promoting communal ownership and action. Participants will learn about real-world examples of urban design and in relation to health equity, as well as gain an understanding of community engagement in various settings and across various determinants of health. So briefly, the Health Equity Initiative is a member-driven nonprofit organization dedicated to building and sustaining a global community that engages across sectors and disciplines to advance health equity. Membership benefits include shaping health equity conversations, such as these in webinar and event formats, as well as social forums. Individual membership is about $105 a year, which studies show increase the commitment to the organization and its mission. And even though many of us have an innate passion to help and serve others, the financial contribution helps support Health Equity Initiative, our nonprofit, with its activities as a capacity-building organization, educating individuals, organizations, and government on how to develop community-based stakeholders, reducing health disparities, and promoting health equity. So please become a member today if you're not already, and thank you for those of you that are. Networking is also very valuable for our members. Our members span disciplines such as housing, finance, government, academia, healthcare. And why? Well, health equity really spans across multiple disciplines. And how? Well, let's define health equity briefly. One definition is providing every individual the same opportunity to stay healthy and cope with a condition regardless of socioeconomic conditions, race, gender, age, social status, living and working environments, and other socially determined factors. Our speakers will describe how their urban design projects were successful using community engagement and tie in the impact of health equity. The focus will be on housing with Sarah from Archive Global, playgrounds with Aisha with Kaboom, and green spaces from Catherine. During their presentations, feel free to ask questions in the chat located on the bottom right of the GoTo panel. And after all the questions, a few questions will be selected for discussion. The lines will be muted for enhanced recording and archiving, and there will be a survey for your feedback as well. So we'll start with housing as a main tenet for urban design. So Sarah Ruel-Bergeron, a project architect with Archive Global, will speak about the impact of housing on health equity. She holds a master's degree in architecture from Pratt Institute, is a licensed architect in New York State, as well as a LEED accredited professional specialized in building design and construction. She is trilingual and has several years of experience in affordable housing and healthcare. She is particularly interested in sustained design and resiliency and has been a volunteer in the Design for Risk Construction Committee at AIA New York City since 2014. So at this moment, I will make Sarah the presenter, and she will start her presentation. Thank you, Sarah.
Hi, good afternoon to everyone, and thank you for joining. Archive Global was started in 2006 by Peter Williams after the development of a 3-year independent research project funded by the King Fellowship from Columbia University, which focused on fear, epidemics, public health, policy planning, and architecture. Archive stands for Architecture for Health in Vulnerable Environments. We use the basic right of housing to deliver the basic need of health. We believe that health should not be negatively impacted by the state of housing, and that by prioritizing housing design as the key intersection between development, health, and architecture, we can combat disease around the world. In light of the growing problem of drug resistance and the high costs of medicine for many common global diseases, we believe that housing can be a key component to improving health worldwide. For the strategies to be successful and accessible, they need to reside in diverse contexts of behavioral change and increased access to health facilities. Each of our projects, although different based on site particularities, cultural specificities, and particular expected outcomes, will have 3 components: research, awareness, and a tie to the built environment. Habitat for Humanity estimates that as many as 1.6 billion people around the world lack adequate housing. The UN estimates that 1 in 8 people live in slums, and that by 2030, that number could double. A slum household is classified as one lacking 1 or more of the following household deprivations: a safe source of water within or near the household, a sanitation facility, such as a toilet in or near the home, and local wastewater management strategies, sufficient living area to prevent overcrowding and related problems, housing durability that ensures that the structure you live within is stable, durable, and safe, and legal access to property identified here as security of tenure. For vulnerable populations who often spend a majority of the day in their homes, each of these components has the capacity to have a significant impact on their health. In short, this is a context within which Archive Global seeks to operate, at the intersection between the built environment and public health. Just as the urban environment has the capacity to provide access to clean drinking water, parks, and transportation systems, in certain contexts, it can also have negative effects on our health. Air quality, basic infrastructure, as well as waste management infrastructure, hazardous land use, and lack of access to amenities can cause infectious diseases such as respiratory infections, waterborne diseases, vector-borne diseases, rodent-borne infections, intestinal worms, and diarrhea, as well as chronic diseases such as asthma, cardiovascular diseases, diabetes, and cancers. However, the public realm is not the only hazard. Our own homes can also cause, breed, or encourage the transmission or creation of diseases and infections. Vulnerable populations spend a disproportionate amount of time in the home and are at higher risk of exposure to a variety of problems, such as mold, which can cause asthma and other respiratory illnesses. Poor floor, wall, and roof construction can host parasites or insects, causing things like dengue fever or Chagas. And direct contact with wastewater or unhygienic environments for food storage can cause problems such as neglected tropical diseases or rodent-borne illnesses. Our projects vary in scope, size, location, and disease being addressed. And you can see a chart of that here. In this presentation, we're going to take a closer look at our London and Cameroon projects as examples. The common thread among our projects is the community engagement focus. Our work is located all over the world, and we believe in the vitality and the strength of the community ecosystems into which we propose our interventions. So our intent is to leave as small of a footprint at the end of the project as possible, while having made a large impact on the quality of life of its inhabitants. We can only do that with a robust community engagement strategy, which begins with a search for an appropriate local partner, one who's well connected to the community we intend to work with, as well as having experience locally with the issues we seek to address. Together, we approach the community to find trusted leaders and work together to develop a list of appropriate beneficiaries, create training material that will be culturally sensitive and locally appropriate, as well as identify any larger campaign opportunities or relevant skills that can be taught to the local tradesmen. At the completion of a project, the community as a whole has a better understanding of how to keep their families healthier, whether through an understanding of best practices to avoid the problem, or with the addition of an architectural intervention, which targets some of the most vulnerable families in the community and have measurable impacts. Local tradesmen are trained to be able to implement additional requests for household interventions or make repairs on these in the long term. Community leaders and health workers remain as trusted resources. As previously mentioned, we would like to present two examples of community engagement efforts in our projects. The project in London, UK spanned from 2013 to 2016 and was developed to combat tuberculosis. The incidence of tuberculosis has doubled in London over the last 20 years, making it the TB capital of Europe, with some areas seeing 150 cases per 100,000 people. It is most prominently found in the boroughs of Brent and Newham, where the majority of the population is immigrant-based and economically vulnerable. Control efforts for this impoverished and isolated community have been hampered by the high prevalence of TB risk factors, such as poorly ventilated, damp, and overcrowded housing conditions. The overall strategy consisted in increasing awareness about the basics of TB transmission and its relationship to living conditions through a televised campaign and trainings in secondary schools. Here on the screen, you can see some of the secondary school initiatives that we did. At a local school, 540 children participated in a workshop to understand the housing conditions that might cause or aggravate tuberculosis and its transmission, symptoms of the disease, and the extensive treatment. The expectation was that they would take this information into their families, homes, and communities. On top of that, we also had 30 community health workers were trained to be able to identify housing conditions that increase risk of transmission, and over time continue to increase awareness throughout the community and be a local resource for information. Finally, there was also an audience of 30,000 people who who were provided with messages about prevention, symptoms, and places to receive treatment. This group was reached through televised and radio campaigns. 3 years into the campaign, the reported incidence of tuberculosis to the National Health Service had decreased by 20%. A similar project by Archive Global was also executed in Camden, New Jersey for asthma prevention. The London project was really an exercise in having a high impact with the least amount of cost. To integrate household interventions directly into the built environment, we did the project in Yaoundé, Cameroon, which spanned from 2013 to 2016 and was developed to combat malaria, which in Cameroon is responsible for 50% of deaths of children under 5. Malaria is transmitted by mosquitoes between 10 p.m. and 4 a.m. So our principal mission was to install screens on windows, doors, and eaves to seal the house from mosquito penetration at night. Our original goal was to reduce the density of mosquitoes found indoors by 20% for 320 homes. The community outreach on this project took multiple forms. More than 5,000 direct beneficiaries were provided with training on the symptoms, causes, and treatment of malaria, as well as preventative measures, including the installation of screens in windows, doors, and eaves, as well as how to maintain the intervention once installed. Direct beneficiaries were defined as the people who would inhabit the homes where interventions took place. 100,000 indirect beneficiaries were reached through local campaigns on television and through the radio to inform them of the symptoms, causes, and treatment of malaria, as well as best practices in preventative measures. 125 community board organization representatives were trained to continue to raise awareness about malaria prevention and be a key resource after project completion. Over 1,000 school children were trained on the basics of malaria transmission and prevention strategies, and 40 technical school students were trained in screening windows, doors, and eaves with the idea that increased demand in the area could be met. As previously mentioned, our goal in Cameroon was to reduce the presence of mosquitoes within the home by 20%. After the screens were installed, mosquito reduction within the households that saw the intervention had reduced by 50%. We continue to work on malaria-proof housing, currently in projects in Namibia, Swaziland, and soon Gabon. These projects are only a snapshot of our work, but we think that they're good examples that begin to demonstrate the importance of a robust community engagement strategy that helps to ensure the long-term success of our projects worldwide. For more information, please visit our website where you can find additional information on our projects, blog posts with informational articles, or our Facebook page where you can find a variety of events. We're also on Twitter at Archive Global. Thank you.
Thank you, Sarah. Wonderful presentation. Our next speaker is Aisha Alexander, the Director of Community Initiatives for Kaboom. She will describe efforts made by this national nonprofit dedicated to giving all kids, particularly those growing up in poverty in America, the joyful, playful childhood they deserve. Aisha leads the organization's nationwide efforts to influence cities to rethink the built environment through the eyes of kids and families living with limited resources. Before joining Kaboom, Aisha held positions creating the strategic vision and implementation plans for youth and community-serving organizations, most recently serving as the Director of Operations for the City of Charlotte's Department of Neighborhood and Economic Development. She attended Hampton University, where she earned her BA in English and Early Childhood Education, and Temple University, earning a Master of Social Work, concentrating in the community and policy practice. Beyond her responsibilities with Kaboom, Aisha spends much of her time working on issues of civil rights and education and criminal justice reform. She's working with groups like the Dream Defenders to organize youth to change the trajectory of their communities. Making Aisha the presenter now.
Okay, thank you so much for having me. Excited to speak with you all about the work that we do here at Kaboom. So at Kaboom, we believe that the well-being of our community starts with the well-being of our kids, and that play is critical to their ability to thrive. We are the only national organization in the United States that is focused solely on creating play spaces in under-resourced communities. So we really believe that the built environment is the value that we place on people poured into concrete. What you see in the built environment really tells people how their city feels about them, values them, and where infrastructure is broken, oftentimes people also feel broken. So where would you want your kids to play? In two very closely located playgrounds, one in Brooklyn Bridge Park in New York that serves higher income residents, and another is in Bayview Public Housing, which is a New York City public housing development. So if you look at these two pictures, where would you want your kids to play? And then more importantly, what do those playgrounds tell the kids that live in each community? So we really look at play as an equity issue. Kids in poverty are missing out on the chance to play all across the country. Across the U.S., especially in cities, too many kids miss out on the chance to play because of where they live, where they come from, or how much their families earn. For the 15 million kids living in poverty in our country, that's 1 out of every 5, play is too hard to come by as their families struggle to make ends meet. Low-income families face many structural obstacles to play, like the lack of safe play spaces, the decline in recess, and then poor infrastructure to get them to safe green spaces where they are able to play. And this has really grave impact. So what we know is play is disappearing. And America's kids are playing less now than any previous generation, and it has many dire consequences from their health, obesity, diabetes, the onset of toxic stress, which has many implications for their health as well. So only 1 out of 4 kids are getting that recommended 60 minutes of physical activity and active play every day. And the numbers are even worse when you're thinking about kids living in low-income communities where those structural barriers exist and where concerns around safety make it harder for kids to play. So the benefits of play are actually very real, very measurable, and I know I don't have to say this, but people take for granted how important play is. It's the work of children, and by missing out of play, they're really missing the opportunity to develop their minds. So develop those critical thinking skills, develop creativity. It improves reading levels, increases the likelihood of kids attending college, certainly reduces the risk of chronic disease, and most importantly, also helps build that self-confidence and resilience that bolsters against onset of toxic stress. So our Kaboom solution is that we go out and we have built over 16,000 playgrounds to increase play for kids in under-resourced communities in the past 21 years. And we rally people, the entire community, around a cause that everyone can get behind, the well-being of kids, and this very tangible project of a play space. In the communities that we've worked in, so often they have been promised things that never come to fruition. They've been left out of discussions. They've been left out of economic development opportunities. They're seeing other neighborhoods flourish, get new infrastructure, and it never happens for them. But our process gives them a very tangible, like at the end of the day, you can actually touch and feel this playground that is going to improve the health and well-being of your kids. But we don't swoop in and just build a playground. We engage community members as a key part of the solution. So they're actually ones that are putting together this entire playground project, uniting their community around the project. We're just the facilitators and provide them with the tools that are necessary, but they are the ones that are actually taking ownership from day one, which is so important, and I'll talk about a little bit more. And in the end, we end up with these safe spaces for kids and families. So the community helps to build this playground that becomes what we've heard over and over again, hallowed ground for that community, where it is a safe space where the community can unite and take responsibility for their health and well-being. So our community build model, every play space that we built with assistance from Kaboom, it utilizes our ABCD community build model. So asset-based community development, based on the belief that all of the answers to the community's issues are within that community. So we involve broad-based community support around the planning and building of these play spaces from day one. So let's talk a little bit about what that looks like. Anytime we go into a community to build a playground, we start off with the kids. Their voices are most important. They are our little planners. They are our play experts. So we start off by having them come together, and they draw for us their dream playgrounds. And of course, they come up with crazy things like chocolate fountains and rockets that go to space. But we actually look at that and figure out, okay, we can't really build a rocket that actually goes to space, but we may be able to build a rocket that they can pretend that they're going to space. So the kids are involved from day one. We can't build something for them without considering their voices. Then we move on to working with the parents and the caregivers and the community associations. So in our process, they are the leaders of this project. As I said, we're just providing them with the tools and helping them to facilitate this process. So they are stepping up, people that didn't think that they could. They are coming together and stepping up in these leadership roles. They're working with nonprofit organizations and corporations where they might be the CEO. There might be the CEO of a corporation in the room, the executive director of a nonprofit that they're working with. But neither one of those people are the expert about their community. So in this room, they are the experts. They are the leaders, and they're given that opportunity to shine and hone their leadership skills. So we go through a asset-based community development asset mapping process to figure out who in the community can help us build these playgrounds. And we rely completely on the parents and caregivers and other community members to really think through, to make this project happen, who do you know? And once we get into this process, you know, it always starts out a little bit slowly. People are like, I'm not sure, I don't really know anyone, but then it turns out, you know, your great-grandmother loves to cook and would love to put together a potluck. Or the book club that your aunt is in really loves to come out and do volunteer projects, and they also know how to sew, and so maybe they could put something together that could be really neat for the project. Your cousin is a DJ. There's just all sorts of knowledge within these communities, and if they're never given the opportunity to unearth them from the gifts of individuals to what associations and institutions are you aware of, then it may never surface, but our process really gives them the ability to do that. So community members come together on a planning committee, and they go through a 6 to 8 week process to really put together this playground building initiative. So there's a play committee, and this is all parents and caregivers, people that live in the neighborhood where we're building a playground. So they work with kids to develop a plan for the kids to be able to play, have some different activities on the build day. There's a recruitment team that will recruit over 200 volunteers that are actually from the community and come out and build the space. The fundraising team, they're going to raise $8,500. They have some real skin in the game. So our playgrounds are upwards of $200,000, but that $8,500, that's their commitment. and they work hard to raise it, and they always do. And you would think, okay, these are under-resourced communities, but they are able to pull this together. The food team will secure breakfast and lunch for all 200 of those volunteers. They may go out and pound the pavement and get lots of local restaurants to offer to provide those meals, or they may have a team of grandmothers who cook them all. We have a logistics team that will secure things like music and restrooms and make sure there's running water. And a public relations team, like where your cousin that always has all of the gossip, may be able to really find that her true skills are in helping to make sure that we are able to get the word out about the project. So then we have the build day, and build day, again, it's 6 hours, 200 or so people coming out and building these playgrounds together. In 6 hours, you have a completely blank space that goes into having this beautiful, safe, not just playground, but we also build the entire space around it with things like outdoor classrooms and planter benches, and all sorts of community beautifying resources, murals. And it's really the community coming together, working again hand in hand. That picture at the top left, that grandparent support, that group came together through this process. So they were grandmothers who decided that they could come out and cook all of the food. They did some beef chili. This was in Baltimore. Did some beef chili the day of the build day. And as they were working through that 6-week planning process, decided they were going to found this group called Grandparent Support. And now they are volunteering in that elementary school every single day. So what we know is our process really works. So after our playground project, we see that people in the community see an increased belief that their community, they can make a difference individually. We see an increased belief that they have a shared sense of commitment to address community issues, from community health to violence, safety, reading levels, everything in between. We've had people that have gone on, that live in public housing complexes, that will go on and say, our interests are not being represented, and guess what, I'm running for office, and have run for alderman or another position, that their potential was realized through this community engagement process. We also have increased belief that their community members are there to support one another. We did 16 playground builds in Baltimore in the wake of the death of Freddie Gray and the civil unrest that happened there. And so one of my proudest moments was seeing the surveys from the youth that were involved in the project and saying that because of their involvement in the Kaboom playground build, they now believe that there are adults in their community that care about them and their well-being. And they also now that feel that they have a person that they can turn to and talk to in times of stress. So that is a tremendous public health benefit. When you think about, there's a proverb that says, welcome children in your city, or they will burn it down to feel its warmth. And we are repurposing that burn it down mentality with this positive activity that everyone can rally around, but in the process, they are coming together as a community to increase their quality of life. So, and fostering those improved community relations and attitudes, and providing that safe haven, again, that hallowed ground for kids and families where they are able to improve their lives. The benefits there are immeasurable, and we're really proud of what we've been able to do across the past 21 years and continue to do to improve health equity in neighborhoods across the country. That's it from me. Thank you.
Thank you, Aisha. Very valuable toolkit on your process. Fantastic results. Congratulations.
Thank you.
So I will introduce our third speaker. So our third speaker and case study will be presented by Catherine Thompson. She's with the Friends of Bushwick Inlet Park. She's an activist for all local issues. By day, Catherine's a footwear designer working in Midtown's garment district, but after hours, she loves being involved with local issues, working with neighbors on shared interests and goals to improve the quality of life for all. She moved to Greenpoint in 1996 with 2 small children. And then back then, there was no local family soccer program in the neighborhood parks. So in 1999, she helped found the AYSO, Greenpoint Williamsburg Youth Soccer League, and was the assistant commissioner for 12 years. And this led to her involvement with the public parks advocacy, as there weren't any safe soccer fields for kids to play on. And so, speaking to Aisha's point, and in 2014, she became the co-leader of Friends of Bushwick Inlet Park. She engages with neighbors, and she's always an activist, and is a pleasure to talk to. So I am excited to make Catherine your next and final presenter.
Oh, can you hear me now?
Yes, we can hear you now, Catherine. We can't see your slides just yet.
Okay.
Would you like me to try again?
Are you able to see them now?
No, not yet.
Okay. Well, I'm sorry. Show my screen. Okay, sorry. So let's see. Can you see them now?
No, one moment. Okay. I'm going to make you presenter again.
Okay.
Yep, we can see your screen now.
Oh, now I took away. Now can you see the slides?
Yes.
Okay, great. Okay, so thank you for having me. It's so interesting to hear Sarah and Aisha's stories, and my story is more specific. It's about, our Friends of Bushwick Inlet Park. It's an all-volunteer organization, and it's about our engagement with the city during the process of rezoning that started in 2005. So what happened was, in 2005, they rezoned the whole waterfront in Greenpoint and Williamsburg to make way for residential development. And it had been originally, heavy industrial, where, lots of heavy, poisonous, toxic industry had happened for, over 100 years. So during the process of rezoning, they had a environmental impact statement, and that showed that our neighborhood was terribly underserved with open space, and that there were very many health issues because of that, and because of all the heavy industry. There's lots of toxic factories that made benzene, and their Standard Oil was had refineries with very toxic coal tar, and we had very degraded neighborhood. Not to mention that we were also home to waste transfer stations, to treatment plants. We had radiac, lots of terrible industry for a legacy that very much poisoned our neighborhood. We have a 17 million gallon oil spill under Greenpoint. That was Exxon. So we had this history of environmental activism. But what happened, so in 2005, they rezoned. They promised as to mitigate the new influx of people coming into the neighborhood, and these new developments along the waterfront, that they would make a 27-acre park. And so here's, so the park was going to mitigate, you know, all the new development, and they were very slow in coming to that. The city had given tax abatements to the developers for the high rises. You know, people were making a lot of money. Lots of families and long-term residents were being displaced because of, you know, the increased housing costs. You know, rents were starting to skyrocket. So in 2015, which was about a decade later, the city had only acquired 16 of the 27 acres. And at that time, we had started getting together, the Friends of Bushwick Inlet Park, and we were going to, you know, start to push the city and sort of find out what was the plan to finish this park. So all of a sudden, there was a big fire. The CitStorage fire, January 31st. It was an enormous fire on the waterfront, and it was actually on the site of the last parcel of land, 11 acres, right in the heart of this park that the city was supposed to be purchasing. So that ignited the Friends of Bushwick Inlet Park into action. And there was a great sense of urgency because the owner of the CitStorage site was, you know, he wanted to make his money and retire. He was putting it on the market, and he wanted as much money as he could possibly get. And the way he would get that is if he rezoned his property, which was manufacturing, and it gets a little wonky, but if it got rezoned as residential, then it would be worth like 2 or 3 times the amount. So he was thinking it was worth $500 million, which just seemed untenable. So we jumped into action, and this is sort of a toolbox of what we did. We were relentless activists, and everything we did required community engagement, and we built a whole coalition of supporters. So in our neighborhood, we already had a lot of people and organizations that were involved with the environment and stuff like that. So we brought them in, we got all the schools involved, and we sort of a list, if you tally it up, we ended up having 6 rallies with all our elected officials, and we had 8 major actions. That included fun things like we had a camp out in the middle of an asphalt, you know, street end one night, or we had a occupy the inlet with boats, and so, and every time we had an action, we would create videos, and the videos would become part of a kind of a social media campaign. But we also did, you know, on the ground canvassing, lots of grassroots, educating people, neighbors, what was going on. We did find that the new residents, the people that kind of came to live in these towers along the river, were not nearly as involved, and it was hard to get them to sort of pay attention to the urgency of this issue at first. And there was a lot of eye rolling, and people sort of thought, there's no way you are going to get the city to buy this property. And at the same time, there's talk of sort of the bridge and Brooklyn Bridge Park model, which involved kind of a private public partnership where, you know, the city would have a, you know, sell a portion of the park so for a luxury high-rise building that would sort of fund the park. And we were adamantly against that. We felt like the park, the people deserved the park needed to be big, it needed to be a big destination for everybody, not just sort of the front yard of one of these luxury towers. So we had our activism toolbox, but we also had our political toolbox. And this was, you know, we had to engage all our elected officials. We had our council member, we had the borough president, we had the senator involved, we had our assemblyman, the public advocate. All these people, we sort of reached out, and they kind of built their own coalition to help us. And during part of our advocacy, and this was all a lot of learning for me, I got involved with the community board, and we had them, they wrote a resolution declaring that there would never be any rezoning of this property. And this was key. So the owner of the property wanted $500 million, but if it was zoned residential, so if we could confirm that it would never be rezoned, it would be worth maybe 150 million or something like that, much less. So all the elected officials declared that they would never support a rezoning, and along with their community board. And then Mayor de Blasio made a declaration that he would never go against the Bushwick Inlet Park and against the local council member and other elected officials. And that was huge. One thing that we did to pressure the city is that the mayor had this whole campaign coming out for mandatory inclusionary housing to expand affordable housing across the city. And that was involving a lot of other rezonings from other industrially zoned neighborhoods like East New York. So we made it our mission to go to all these community boards and tell people about the broken promises, the bait and switch, where, a community is offered, a promise, great rezoning, new housing, new parks, and what happens is the developers end up winning and profiting, and the local people are displaced and parks never materialize. So they got used to us showing up, and we put a lot of pressure on the city that way. And so we had a lot of different groups of activists that were involved. So we made the broken promises a citywide issue, and then one great thing that did come out of this was that the public advocate Letitia James, along with Councilmember Espinal and the Speaker of the Council, Mark Viverito, actually came up with a bill, and it's like kind of an accountability bill, because in order to go forward with rezonings in impoverished neighborhoods, or anywhere, I guess, that they wanted to create a system of accountability where promises were sort of marked and charted, and that it was actually turned into a law, so that these promises could not be made empty-heartedly. So the great news is we did get the park. So Mayor de Blasio actually acquired the CitStorage site, and he paid $160 million, which is a huge amount of money. But it's going to be a park. It'll never be anything else but a park. And the park site is actually mostly an industrial wasteland. And so it's even going to cost more because it has to be remediated. It has to be built out. But in the meantime, there are these little areas where we can participate in our park, and we have built partnerships. This is in the last 6 months. We are doing cleanups, planting daffodils, and one exciting project we've got going, and we wrote a grant for it and got it from the city's Citizens Committee, is a Billion Oyster Project. And this is a partnership with this group that is going around, and they're sort of seeding the East River and the New York Harbor and other waterways with oysters. And oysters they kind of create their own infrastructure under the water. And this is all about sort of building natural infrastructure for resiliency as we are facing climate change. And they also are amazing cleansers of the water. So we've got our own we've got 4 cages of oysters that they've just been planted, and we are working with a local middle school, and that requires that the teachers get trained and the children get trained, and it's an amazing organization. So we're partnering up with them, and then we can only access this by water. So we have partnered up with the North Brooklyn Boat Club, which is human-powered watercraft, and they are so we paddle. People have to paddle down there in the kayaks and They measure the oysters, and this is another organization that we're working with, the Newtown Creek Alliance, which is an ecological watchdog for the Newtown Creek, and it's big on education. So we're starting our partnerships with, to sort of build out where we can. And right now we're super excited because you can see this picture of a empty lot, and that is a parcel of land. It's about 3.5 acres that was just recently remediated. It was covered with a big tent. They had to go in, take out all the coal tar from back in the day, and Standard Oil had their first factories back in the 1800s and contaminated this soil. And so National Grid was required to clean it up, which they did, and they delivered it. And it's sort of, it's just a big, open, dry space with chain link around it. So we are working with a neat landscape firm in the Parks Department to try to come up with a scheme that will allow public engagement. We're sort of thinking about agricultural engagement, landscape literacy, learning about plants and the history of resilient plants and indigenous species, and we're building on this idea of building kind of what Aisha's talking about, where the people sort of direct it. So it's going to be very loose. It's actually not even, it's just in its really, incubator stages right now. So it's hard to talk about it exactly.
Catherine, this is Frizo. We need to wrap it up soon in the next 2 minutes. Great, thank you.
Okay, and but I wanted to bring in this idea of health equity, and so I've been talking about the western part of Williamsburg and Greenpoint, which is along the East River, and there's another side, the south side of Williamsburg, which is has a different demographic and a different history, and they have serious health equity issues over there, and you can compare the two sides, and the north side is 15 times amount of park space. South side's park space is primarily hardscape. They have terrible pollution because of the BQE that runs through it. And so there's a neat initiative that we are very actively involved with supporting, which is called the BQ Green. And it's the idea of trying to connect the two sides of Williamsburg that were divided by the trench that was the BQE back in the 1950s with Robert Moses. So the idea is to add in space by decking over part of the BQE that would add like 3.5 acres and allow for open space and much cleaner air. And we're really excited about that. That's a little about trying to support them in their efforts. And I guess I'll just shut it down there.
Wonderful. Thank you so much. That was great, Catherine, especially the last slide showing the impact that you're making for health equity. I am going to move into the question and answer session. And to kick us off, I'll start off with a question that was prepared. So when you compare your efforts and successes to other organizations, how has your approach to community engagement been a differentiator or a key success factor? And maybe I can direct that one first to Aisha, and then maybe over to Catherine and Sarah. So Aisha, you have the mic.
So I think the key way that our community engagement process is different is in how we engage kids. We don't build things for kids, we build things with kids. They are, as I said, designers in the process, And that's very important because we're talking about increasing active play for kids. So we want to build things that excite them, things that they will actually use. So we can't make assumptions about what those things are, and it's different for every community. And so engaging them in the process is critical.
Wonderful, thank you. And that might be a little bit more tricky for Sarah, but is that the case in the housing space as well?
Well, I think that our environment is starting to even get a little bit crowded, which is wonderful. I mean, we have the UN focusing on housing issues, and a lot of organizations starting to get on board. So we think that that's great. One thing that is tricky, and I don't know if this necessarily differentiates us from other organizations, but it's something that we will all have to focus on as we do global work, is the partnerships component. And I think Aisha's example showed this very well. You have to have buy-in from the community, and so we look for local partners, but we also have to get down beyond the local partner to really people who are engaged in the community every single day and who are walking the streets as everyone who we want to participate in the program. So that's where our big focus is, and it's something that we're continuously learning from. Every project is slightly different. Every project has cultural specificities, but the more we dig into it, we realize that the key component and the key driver of making these projects have long-term sustainability is really that partnership that we can make locally and then even further at the community level.
Thank you. And Catherine, is there a differentiator between what Bushwick Inlet Park has done and what that BQE Park is also trying to do?
Well, I think the Bushwick Inlet Park, we were faced with this great sense of urgency, and there's a very specific goal, and it was very easy to, garner support with all different groups, and it was, like we said, relentless activism. And now we are facing, more incremental and building out, and are also exactly doing that, trying to engage our community and learning about how to do that. And over in the Southside with the BQ Green Project, they have a different demographic that maybe isn't so connected to, isn't even that aware of how affected they are by the toxicity of their neighborhood. So they are doing an amazing job going out and with a grassroots on the ground effort to education. And this is through El Puente, which is an academy and a environmental justice organization over there. And they have two components. They have the Green Light District, which is actually engaging the neighbors and the students and school to measure and measure the particulates in the air and the parks, and they're engaging them scientifically. And then there's another group called Mothers Out Front. So they're getting the moms involved with and starting the, an education awareness and, building a grassroots effort that way. And then, obviously we want to help and support them any way we can. And we're just letting them sort of lead the way there as we go.
Fantastic. Well, this, I believe the presenters have done a fantastic job of being able to share how they've been improving the physical environment to advance health equity by leveraging the community and engaging them. I thank all the registrants. There are over 100 registrants for this webinar, supported by the Robert Wood Johnson Foundation in partnership with Gehl Institute. Thank you for everybody on the Health Equity Initiative as well for all of your participation. Again, fantastic presentations, Catherine, Aisha, and Sarah. Please look out for our next and final webinar in the series, September 13th. It will also be about the strategies for urban designers to engage local communities. And really appreciate you being a part of this and sharing the awareness for health equity in your organizations. Thank you very much and have a great rest of the afternoon.
Thank you.